We are Group 1, and for our project we decided to address the issue of Syrian refugee health using a One Health approach. What is the Syrian refugee health crisis, you may ask? Due to civil unrest within the country, about half of the country's pre-war population has been displaced, with about 5 million Syrian citizens being forced to seek asylum outside of Syria. The primary countries that have been accepting these refugees are neighboring European nations, mainly Germany, as well as Turkey, Lebanon, and Jordan. Some important factors to consider are the crowded camps that many refugees are confined to, which in turn impacts their health as well as the health of the local communities. Furthermore, these diseases affect the environment of the host country. We must also consider the limited access to healthcare that refugees have, and finally the role that animals play as hosts. Since this issue impacts human health, animal health, and the environment, and will also require many different specialties and governments collaborating with one another to avoid a mass outbreak of disease, we believe that the only logical approach is a One Health approach.
For the top-down approach for controlling the amount of disease transmission amongst the Syrian refugees, the involvement of multiple national health authorities and leaders is necessary. Organizations such as the World Health Organization, the United Nations, Doctors Without Borders, the German, Turkish, Jordanian, and Lebanese government officials and legislation will need to be involved and considered. By government-led resources such as clinics for immediate medical attention, food distribution, and schooling sites for children can be organized and funded through governmental implementation, as well as the training of Syrian health leaders for preparation and response teams in case of epidemic. Methods of public awareness campaigns of limiting exposure with livestock for echinocosis control, the prevention of cholera since contact with sewage is probable for Syrian refugees, plans to improve cholera preparedness, response intervention, setups a standard operating procedure for early detection, and training for Syrian health officials, as well as governmental organized aid for vaccination, insecticide-treated clothing for leishmaniasis control. By using a top-down approach, by implementing government and NGO to sanction relief efforts, there's a greater chance for access to immediate needs and prevention methods through the providence of materials. However, this type of aid can create dependency issues and not usually sustainable long-term.
For our situation, we will need to include the refugees and any local community organizations associated with their health and living conditions for any important decision-making process. This is known as bottom-up approach. For the short run, considering their refugee status, the best way to address the diseases and infections will be to distribute volunteers throughout the community and relay their health to collect data and process into information, so that we can identify additional causes of their detrimental health and generate solutions. We will need to reach out to non-government organizations and construct a specialized team of volunteers who will support the Syrian refugees in both medical aid and political status. By doing so, they will gain traction and educate the populace of the country through media and grassroots approach in order to help them of their mental and physical health.
There are some roadblocks to consider when trying to help out Syrian refugees. These include money, politics, and diseases. Providing the proper health care to Syrian refugees is costly when considering the plethora of physical and mental health problems refugees face. It's very important to come up with an economical plan and utilize all the funds received from donations from organizations such as Save the Children and Doctors Without Borders. We should also consider politics. Some European citizens may not like the idea of providing healthcare to Syrian refugees in their country. We must educate people about the bottom-up approach and remind them that this is a One Health issue. And of course, there's always a risk of contracting diseases or transmitting pathogens. This is why it's very important to implement good sanitation and vaccinations.
Outreach is a crucial part of this One Health issue because of the affected populations. The One Health triad works in conjunction with the Syrian refugee crisis because of the impact and involvement of the environment, animals, and humans. This problem does not only affect the Syrian people, but many different populations as well, including you. The most important stakeholders are the community and general public, government NGOs, and Syrian refugees. Ways to tackle this issue include access to adequate living conditions and healthcare necessary to reduce the spread of infectious diseases. Health education promotion among refugees emphasizes necessary health assessments and benefits of screening, and developing a support team for the management of infectious diseases in Syrian refugee camps. Together we can become educated about the situation, spread awareness to others about the complexity of the issue, propose solutions, however big or small, and become an advocate for the betterment of the futures of Syrian people.
Created using Powtoon.